Welcome to MLE Masters. In this high-yield USMLE lecture, we're diving into pharmacokinetics, which simply means what the body does to the drug. It's the foundational principle that governs how drugs are absorbed, distributed, metabolized, and excreted, collectively known as ADME. These concepts are crucial for understanding drug dosing, plasma levels, half-lives, and clinical pharmacology decisions. Let's break it all down step by step and make it simple, concise, and board relevant. Absorption is the process by which a drug enters the bloodstream from its site of administration. It varies by route: oral, IV, IM, subcutaneous. Bioavailability F is the fraction of drug reaching systemic circulation in active form. IV drugs have 100% bioavailability, while oral drugs have reduced F due to first-pass liver metabolism and GI absorption limits. This impacts dosing decisions. Drugs with low F or long half-lives often need loading doses to achieve therapeutic levels faster. After absorption, drugs distribute to body tissues. The key concept here is volume of distribution, VD, a theoretical volume that describes how widely a drug spreads. High VD drugs leave plasma and enter tissues, lipophilic drugs. Low VD drugs remain mostly in the blood, hydrophilic drugs or plasma protein-bound. VD impacts toxicity management and drug clearance. Drugs with high VD are harder to remove via dialysis and may require dose adjustments. Drug metabolism primarily occurs in the liver in phase 1 and phase 2 reactions. Phase 1 involves oxidation, reduction, hydrolysis, mostly via cytochrome P450 enzymes, slightly modifying the drug. Phase 2 conjugates the drug, e.g., glucuronidation, sulfation, acetylation, making it more water-soluble for excretion. Enzyme inducers, rifampin, phenytoin, speed up metabolism. Inhibitors, cimetidine, grapefruit juice, slow it down. This affects drug levels and interactions, a common step 1 vignette favorite. Excretion eliminates the drug from the body, mainly via kidneys, but also via bile, feces, lungs, and sweat. Renal elimination includes glomerular filtration, unbound drugs passively filtered. Tubular secretion, active transporter mediated. Reabsorption, lipid-soluble drugs re-enter blood. 2 key parameters: clearance, CL, volume of plasma cleared per unit time. Half-life, T12, time for plasma concentration to reduce by 50%. These influence dosing schedules and accumulation. Half-life, T1 and 2, depends on VD and clearance, calculated as T1, 2 NERS, 0.693 XVD, CL. It guides dosing intervals and time to steady state. Steady state is reached when drug intake equals elimination, typically in 4 to 5 half-lives. Important formulas: loading dose, MART, target conc, XVD, F. Maintenance dose, ZAR, target concern, X, CL, X dosing interval, SIN, F. These help achieve and sustain therapeutic levels, especially in long-term therapy. Bioavailability F reflects how much drug reaches systemic circulation in active form. IV drugs have 100% F. Oral drugs have reduced F due to GI factors and first-pass metabolism. AUC, area under curve, compares IV versus oral drug levels. F measure AUC oral, AUC for 100. Bioavailability impacts oral dosing and is critical in designing effective regimens. Low F drugs may require higher doses or alternative routes. We use PK models to understand drug distribution over time. One-compartment model assumes uniform distribution. Two-compartment model divides drug into central, plasma, and peripheral tissue compartments. Some drugs, digox and thiopental, have delayed distribution due to peripheral tissue uptake. These models help interpret concentration time curves and guide clinical decisions, especially for drugs with long redistribution phases. Quick recap: pharmacokinetics sought ADME. Absorption, entry of drug into blood. Distribution, drug spread, D. Metabolism, liver processing, phase 1 and 2. Excretion, renal or hepatic elimination. Key terms: VD, CL, T12, F, loading and maintenance doses. These concepts are USMLE favorites and crucial in both clinical and exam scenarios. Thanks for watching this USMLE pharmacology session on pharmacokinetics. Hope you found it concise and high yield. Like, share, and subscribe to MLE Masters for daily medical learning. Stay consistent, stay sharp. Your Step 1 prep just got stronger.